Hello, I'm Dr. Fiona Tewe, and welcome to the World Health Organization's WHO Africa Media Briefing, which is taking place in collaboration with the APO Group. First, as usual, we have our housekeeping. You can choose the language you'd like to hear the press conference by turning to the globe on the bottom right of your screen and selecting your language. Francois?
Oui, bonjour à tous. Merci de nous avoir rejoints pour ce point de presse de... Excusez-moi, bonjour à tous. Merci de nous avoir rejoints pour ce point de presse de l'OMS. Si vous souhaitez écouter la conférence en français, merci de cliquer sur l'icône en forme de globe qui est située tout en bas de l'écran à droite. Fiona, back to you.
Thank you very much. And at the end of the panelist speeches, we shall give you a chance to ask your questions. You can use the Q&A option at the bottom of your Zoom application, or if you want to go live, also let us know and we'll give you that option. Joining us today from Brazzaville, Congo is Dr. Masiriso Moeti, the WHO Regional Director for Africa, and I will let her now introduce our other panelists.
Thank you, Fiona. So good morning and good afternoon, bonjour, bon dia, to all the journalists joining us and to everyone watching online for this press conference on the vaccine rollout across the African region and continent. I'm very pleased to be joined by the Honorable Dr. Osagie Enahire, Minister of Health of the Federal Republic of Nigeria, and by the Honorable Dr. Sidi Zahaf, the Minister of Health of Mauritania. Welcome, Minister. Bienvenue, Excellence, Monsieur le Ministre. They will tell us about the COVID-19 vaccine rollout in their countries. But first, a look at the latest on Africa's COVID-19 pandemic. Africa's third wave is at a crossroads. Following 8 consecutive weeks of a fast-moving surge, the rate of new cases slowed down, falling by less than 2% last week, driven by a sharp drop in South Africa, which accounts for a third of the continent's reported new cases. Yet, removing the data from South Africa reveals a uniquely steep and unbroken 9-week surge that's already 80% higher than Africa's previous peak. 21 countries are experiencing a resurgence. That's 3 more than last week. The gains in South Africa are also uncertain as the country has been grappling with violence and protests. These have disrupted key response activities such as surveillance and testing. There are also real concerns that the mass gatherings could trigger another rise in cases in South Africa. There have now been more than 6.2 million COVID-19 cases and over 159,000 people have lost their lives. Deaths have also declined by 3.5% over the past week, but a tracker published by the nonprofit group PATH finds that 13 countries have seen their oxygen requirements increase due to a surge in cases. Let us be under no illusions. Africa's third wave is absolutely not over. The small step forward offers hope and inspiration, but must not mask the big picture for Africa. Many countries are still at peak risk, and Africa's unprecedented third wave surged up faster and higher than ever before. The Eid celebrations, which we mark this week, may also result in a rise in cases. We must step up surveillance and be prepared. We must all double down on prevention measures to build on these fragile gains. And countries must prepare for an increase in cases, especially severe illness, and what needs to be done to limit people dying. Turning to COVID-19 vaccines, Africa continues to lag behind, sadly. Just 20 million Africans, or 1.5% of the continent's population, are fully vaccinated so far. Just 1.7% of the 3.7 billion doses given globally have been administered in Africa. Yet Africa's supply crunch is starting to ease. The first delivery of doses donated by the United States government through the COVAX facility are arriving in Africa this week, and altogether nearly 60 million doses are expected in the coming weeks through COVAX from Team Europe, UK, purchased doses, and from other partners. African countries must go all out and speed up their vaccine rollouts by 5 to 6 times if they are to get all these doses into arms and fully vaccinate the most vulnerable 10% of their people by the end of September. Around 3.5 to 4 million doses are administered each week on the continent, but this needs to rise to 21 million doses each week at the very least to meet this goal. Over 500 million doses are expected through COVAX alone this year, and a massive influx means countries must up their game. To increase uptake, countries need to scale up operations, investments on operational costs, and address vaccine confidence. Countries need sufficient vaccine sites and healthcare workers, sufficient vaccine storage, and adequate transport and logistics for distribution. WHO is working with countries to better plan and cost operational plans and delivery processes to support the second phase of the COVID-19 vaccine rollout. Vaccines are key to saving lives and blunting the pandemic, but we must remain focused on controlling the disease until vaccination coverage is increased. So we encourage everyone to protect themselves, their families, loved ones, and those around them by wearing masks, keeping a distance, and practicing hand hygiene. The public health and preventive measures are key to ending this pandemic and saving lives. I look forward very much to our conversation with the two honorable ministers today and with you, and I thank you once again for having joined us.
Thank you very much, Dr. Moeti. We have heard that a number of vaccines indeed are coming into the countries. Honorable Dr. Osagi Ehanire from Nigeria, how is Nigeria preparing for the large influx of COVID-19 vaccines that you are expecting?
Thank you very much. I want to thank you for the opportunity to contribute to this very important press briefing. And I must first commend the leadership provided by Dr. Moeti, who has helped us a lot by giving an Africa-specific perspective and guidance to our response. We have had strong support of WHO, Gavi, and also the government of Nigeria with setting up of the Presidential Steering Committee, which brought relevant ministries and agencies together in a multi-sectoral whole of government response mechanism. Ministry of Health has led the health-specific with its agencies, the Nigeria Center for Disease Control and the Primary Healthcare Development Agency. The challenges we have faced are the relatively weak health systems we have and the inequity in distribution of COVID-19 response tools, from PPEs and reagents at the beginning to vaccines at the present moment. I wish to appreciate the recent attention to vaccine distribution, especially from the COVAX facility, the Harvard facility, and also the bilaterals with the United States government, the UK, and others, and urge high-income countries to do more to support low and middle-income countries. Nigeria received just 4 billion doses of AstraZeneca to start with from the COVAX facility and the government of India. And we started deployment very early, according to the WHO recommendation to prioritize health workers and vulnerable populations. Vaccines, first of all, received the emergency use authorization from NAFDAC, the Nigerian Agency for Food and Drug Administration and Control. Our vaccine implementing agency, which is the Nigeria Primary Healthcare Development Agency, has vast experience, especially from the recently concluded polio eradication campaign, and also the routine immunization, which it has been working on for several years now, and using ICT tools for a smooth rollout. Infrastructure, especially the cold chain, and also precise distribution plans were ready well before the vaccines arrived. And we have already expended by now all the vaccines, with 126% of target population of just over 2 million people receiving the first dose and 70% receiving the second dose. But less than 2% of the target of 112 million eligibles have been reached in our destination to get 70% vaccinated for herd immunity. We have had efficient data management and monitoring well performed by NAFDAC and MPACDA together for all the adverse effects following immunization. However, we have begun to see a pandemic of flu tracks where variants, the Delta variant is tearing through the unvaccinated population. And we also see the unfortunate surge in cases in India a few months ago, and the similar surge now beginning to rear its head on the continent of Africa. In Nigeria, the Delta variant was detected about 2 weeks ago, and we have begun to see a gradual increase in the number of cases. We worry a lot about that because our demographics are similar to India, and we have instituted various alert mechanisms. First, new prioritization of areas with high prevalence, especially when vaccines arrive, and also generally the prevention infection control mechanism. We have begun campaigns in all communities to adhere to non-pharmaceutical interventions and also the public health measures that have been much touted in our country. There is no doubt that we in Nigeria, and like most of the other African countries, will continue to suffer from gross inequity. So the most at risk, which are health workers, older population, and those with underlying illnesses, are presently unprotected, especially in lower middle income countries, while the rich countries are vaccinating those who are much less at risk of getting this disease. So the Nigerian response so far is a state of readiness to confront any increase in the cases that come up. We are doing genetic sequencing to follow the trend. We're observing the trend in other countries, in Europe, and the resurgence even in America, and trying to adjust even in our travel protocols, points of entry. We have carried out surveillance not only at air arriving ports, but also land borders with rapid diagnostic tests. And we are beginning also testing at sea points of entry. Thank you for the opportunity.
Thank you very much, Honorable Ehanire. So now let's move to Mauritania. Honorable Dr. Sidi Zahaf, how is Mauritania's COVID-19 vaccine rollout going? Dr. Zahaf, Honorable.
Excusez-nous, madame, le ministre vient d'un moment à l'autre. On l'attend d'un moment à l'autre. Il était dans une réunion et il vient d'un moment à l'autre. Donnez-nous quelques minutes, s'il vous plaît.
That's very fine. That's more than fine. So, okay, here, this is the minister, right? Welcome, Honorable Dr. Zahaf. So I had a question for you, and could you tell us how Mauritania's COVID-19 vaccine rollout is going?
I believe the minister is still delayed, so perhaps we should move on to questions and come back to the Honorable Minister when he's back.
Okay, thanks, Saya. So now we shall move to the questions. Journalists, remember, we are at the end of our speeches from the panelists as we wait for the Honorable Minister from Mauritania. Now, you have a chance to ask your questions. Again, I remind you to use the question and answer function of the Zoom application. But also, if you need to go live, let us know by putting up your hand and indicating so. Please remember, you'll also need to provide a name and the news organization that you do represent for your question to be answered. We have on hand Dr. Tieno Balde, the Program Manager and the Deputy Incident Manager for the COVID-19 response in the WHO African region. We have Dr. Richard Mihigo, the Coordinator for Vaccine Preventable Diseases Program. And we also have Dr. Nixie Gumede, who is the Regional Virologist. And all your questions, we hope, can be answered today. So we start with a question from Naftali of Shinwa. And this goes to you, the Honorable Minister in Nigeria, and says, do you think that African countries are sufficiently prepared for the next phase of the COVID-19 rollout? So I'll hand this over to you, Honorable, and then we can have Dr. Moeti also give a comment on the same.
I do not believe that all African countries are that prepared. There are countries that require some support. And I know that WHO has been very helpful in trying to offer assistance and support, not only in training and in advice, but also in organizing the infrastructure that's required, cold chain equipment, and distribution plans. In Nigeria, we are very worried because of our population and the similarity with India, both high population density, and the fervor for politics and religion, which lead people very often to ignore the public health advice that is put in place. I believe that training and support must continue to be offered to African countries, particularly those with relatively weak health systems, and also the risk communication and community engagement, which are the most important and also the simplest and cheapest ways of trying to confront the spread of the third wave or the COVID-19. I don't think that this can be done in a very short time, but there has to be a lot of emphasis and pressure put on governments across Africa to wake up to the risks of this virus spreading across the continent. Over.
Thank you, Honorable Minister. So as Dr. Moeti gives her comments on the same, she still has a question from Naftali Mwaura, again from Shinwa, who asks, has the global vaccine supply crunch that stalled vaccination on the continent been tackled? To you, Dr. Moeti.
Okay, thank you very much for those questions. So, well, it's our view that African countries need to work intensely now to ramp up their preparedness and the readiness to start using as effectively and as efficiently and as quickly as possible the vaccines that are starting to arrive. And I'm very pleased that our member states have responded and are sharpening their preparedness and actually looking to learn from the first round of doses that they administered to see in each country what were some of the challenges they faced and what do they need to get better prepared. The first thing is around financing. We've seen that countries need to really drill down to the micro planning to make sure that sufficient financing is available for all the aspects of delivering vaccine. It's not just a matter of receiving the vaccine. We have to make sure that the people, very many additional people who have to deliver the vaccine are mobilized and are paid if they need to be paid, which they do. That we also organize the payment for various aspects, the transportation of the vaccine from where they are received to the various sites, the establishment of sites, not only at the central level in capital cities, but in hotspots, starting with the hotspots, but around the country, and making sure that the cold chain and other aspects that are critical are available. So for me, financing is absolutely vital, and we're helping the countries to update their micro planning so that we ensure that the costing of the plans as well is improved. And then secondly, we've said that countries need to ramp up significantly 3 to 5 times their capacity to roll out the vaccine. So that means that we need to look at all aspects of this operation and make sure that they are speeded up. For example, we have carried out in WHO a survey of 35 countries to see how ready they are in terms of their cold chain capacity. And we found that about 30% of countries have over 50, half of their districts, with gaps in cold chain refrigeration capacity. So that means there's a lot of work to do in the next few weeks, working with our partners, and on behalf of COVAX, but UNICEF is supporting countries to ramp some of this up. And for example, we have 40% of countries with 30% of countries have districts with less than 20% of cold chain capacity. So there's a lot of work still to do. We have learned many lessons, and countries have learned many lessons from the first round. And what are these? For example, we need to improve further on registration of patients, use technology to the extent possible, but adjust where we know that people have access difficulties in terms of mobile phones and even connectivity. There is need to work multi-sectorally, and I'm very glad to hear that the Minister of Nigeria was sharing that that is what they did, because it's not only the health sector that has to support this effort. So putting that platform in place at the national level, then making sure that even at the local level, these different aspects of the government, civil society are working together in order to support the delivery is absolutely important. Then we need to address the issue of vaccine hesitancy. So this communication, targeting people, targeting the messages that we are tracking, and the misinformation or the fears and misconceptions is absolutely vital now, because the time to mobilize people to be ready to be vaccinated is not when the vaccines are landing. It is now in this narrow period of a window that we have to do all of this. And then, of course, we have to use influencers, leaders that people believe in. They need to be indicating that they are going to be vaccinated. The more we see people in leadership positions being vaccinated, the better. I believe we also need to work with people who have been vaccinated. They are the best witnesses, if you like, who can comfort and reassure the rest of the population to be ready to be vaccinated. So these are the type of actions that are needed. And as WHO, we're very ready to work with our partners to support in the next few weeks the intense level of activity that countries have to do to be ready to deploy the vaccines that are now starting to be delivered.
Thank you very much, Dr. Moeti, for that reassurance, even when we see that the work at hand is quite bulky. So, Honorable Dr. Sidi Zahaf, we are very glad to see you and to have you on this press briefing. So we would request you to tell us how Mauritania's COVID-19 vaccine rollout is currently going.
Bonjour. Merci beaucoup pour nous avoir invités à cette réunion très importante. Je salue la directrice régionale de l'OMS, l'ensemble des partenaires ici présents et les représentants de la presse. Alors, pour ce qui est de la Mauritanie, notre plan national de déploiement des vaccins vise à vacciner 63% de la population. Le plan a été élaboré sur la base de la vaccination classique, des stratégies classiques de vaccination, à savoir les vaccinations dans les sites que sont les structures de santé, la vaccination à travers des équipes avancées et des équipes mobiles. Mais aussitôt, avec la livraison séquencée des vaccins, on s'est rendu compte que cette planification, cette vaccination est toute particulière. Elle est différente des activités de vaccination qu'on a connues jusqu'ici, parce que jusqu'ici, les campagnes de vaccination qu'on a eu à organiser sont organisées avec le nombre de vaccins requis qui est déjà disponible. Et donc, il s'agit de déployer la logistique pour distribuer les vaccins disponibles et lancer une opération de vaccination de quelques jours pour atteindre les cibles fixées. Alors, cette fois-ci, c'est comme si on reprend les mêmes activités chaque fois quand on a un lot de vaccins. Aussi, certains vaccins avec des rappels aussi constituent une autre difficulté à laquelle nous sommes confrontés, comme certainement tous les autres pays, parce que quand on reçoit des vaccins, on essaie autant que peut se faire d'administrer ces vaccins en première dose, et donc il faut attendre la seconde dose, et c'est le cas actuellement de la Mauritanie où nous avions récemment organisé une campagne de vaccination en quelques jours pour écouler une quantité de vaccins AstraZeneca qui devait périmer en fin août. Alors, on a dû administrer tous les vaccins et nous sommes en attente de la deuxième dose de vaccination. Ceci étant dit, nous comprenons parfaitement les difficultés pour ce qui est de la distribution des vaccins compte tenu de leur disponibilité au niveau global. Et nous remercions vraiment tous ceux qui ont contribué à la mise en place de ces mécanismes globaux, multilatéraux, bilatéraux, pour un accès équitable à la vaccination. Parce que tout simplement, compte tenu de cette situation d'insuffisance de vaccins, sans ces mécanismes, certainement, nous n'aurions pas pu avoir des vaccins, quelle qu'en soit la quantité. C'est pour cela que nous remercions vraiment les efforts consentis par l'OMS, par Gavi, par l'ensemble des partenaires dans le domaine de la vaccination pour mettre en place ces mécanismes qui permettent à tous les pays d'accéder aux vaccins. Nous comprenons parfaitement le problème de disponibilité des vaccins, mais nous pensons que des mécanismes de distribution peut-être transparents, consensuels, doivent être mis en place et qu'en fonction de la disponibilité des vaccins, que chaque pays puisse savoir préalablement à quoi il peut s'attendre comme vaccin. Et cela nous facilitera la planification et l'opérationnalisation des activités de vaccination une fois les vaccins sont en place. Et aussi de travailler sur l'acceptation des vaccins quand on a des prévisions plus ou moins connues et quand on sait à quoi on peut espérer comme vaccin dans le temps, on sera à l'aise dans l'appel à la vaccination, dans les activités de promotion de la vaccination et de sensibilisation des populations. Encore une fois, je vous remercie et je remercie la directrice régionale pour avoir organisé cette rencontre et pour nous avoir y impliqués. Nous en sommes très reconnaissants et merci encore une fois.
Thank you very much, Honorable Minister from Mauritania, and indeed we are glad to have you with us today. So we were in the session where journalists were asking their questions to the panelists. So right now we continue and go to you, Paul Adepoju from The Lancet. Please go live with your questions.
Yes, thank you very much for this opportunity. So my questions go to Nigeria's health minister. Nigeria has used up 99.97% of vaccines received, but while over 2.5 million people got the first dose, only about 1.4 million people got both doses. So what is the plan for the remaining 1.1 million people that are yet to get the second dose? And what and when is the next vaccine shipment coming in? And what is Nigeria doing to join South Africa and others that are involved in the discussions around local vaccine production in Africa, considering Nigeria is the continent's biggest vaccine market and could still be vulnerable to other countries' decision to restrict exportation of vaccines in their own national health interest right now and in the future? Thank you very much.
Thank you, Paul. So I hand over to the Honorable Minister from Nigeria.
Thank you very much, Mr. Adekoju. When we got just over 4 billion doses of vaccines, we began immunizing all citizens with the doses, hoping that by the time we exhaust the dose, we shall get more doses coming in from their supplies, from COVAX or Covet. But with the outbreak in India, it became clear that we are not going to get enough vaccines, and that the 12-week interval we gave might expire before we got new vaccines. So we changed our tactic to immunizing, instead of about 4 million, giving just over 2 million, 2 doses each, so that you have 2 million who are fully vaccinated rather than 4 million who are half vaccinated. But with time, we got assurances of second doses, more shipment coming in, and which includes AstraZeneca. In fact, we are going to get about 500,000 or 600,000 in addition to 3 million that's already promised by August, but about 600,000 before the end of this month. So we changed again to immunize, give more first doses. We do hope that by the time the 12 weeks elapse, we will have received enough doses of the AstraZeneca vaccine, which is the only vaccine we are using so far, to give second doses to all the others who have had only one dose so far. So the strategy for more vaccination, for more vaccines, is beginning to pay off. And we're expecting other types of vaccines. Now we're expecting more of Moderna and Pfizer, and in fact, Johnson & Johnson, 29 million doses. As for local production, Nigeria is keenly interested in being a hub for local production in Africa. We have worked out a business plan. There is a company in Nigeria, private partnership with government, that is to lead the vaccine production. We are going to bid for technical support and be one of those considered for production of vaccines Africa. Over.
Thank you very much, Honorable Hanire. And our members, distinguished members of the press, we do have a huge number of questions, and we request you to limit your question to at least one priority question for our panelists to answer. So next we go to Gabriel from, Gabriel, please come on with your question. Gabriel from Wall Street Journal, go live with your question.
Hi, thank you so much. This is a question for the Honorable Minister from Nigeria. You spoke a little bit about the shortages you've experienced in terms of supply. Are you expecting any doses from as part of the US donation? And if so, how many and when do you expect to see them, and what vaccines, and given how constrained the supply is in Nigeria, were you surprised that you weren't among the first countries to receive some of the US vaccines? Thank you.
Thank you. We are expecting many vaccines from many sources. So things have changed from a time when we had a lot of anxiety about when we are going to get the new supply of vaccines. Right now, Nigeria is in the process of paying for 29 million doses, just over 29 million doses of vaccines from the African Vaccine Acquisition Task Team, Johnson & Johnson. And so that process is ongoing. We shall not receive the vaccines before, I think, August. But we have a bilateral arrangement for Moderna vaccines, which we have just received through the COVAX facility from the United States, 4,080,000 doses, which are expected in time. We already prepared the cold chain equipment for that. We're expecting 3,900,000 of AstraZeneca, and another 3.5 million of the Pfizer. So if all goes well, as from the end of this month, July, through August and beyond, we are going to have more doses and more varieties. All these vaccines have already been given emergency use authorization by the Nigeria Agency for Food and Drug Administration and Control, NAFDAC. And we have prepared for all the diversities, various types that are coming in, both those that require ultra cold chain and those that require ordinary refrigeration. The teams are all prepared. The collaboration between the state, the federal government and the state, and distribution to last mile has all been set up, and all the monitoring mechanisms are in place to begin immediately, not only distribution, but the administration of vaccines, and also taking record, collecting data of adverse effects following immunization. So we are looking to scale up the vaccination capacity, the rate at which it is being administered right across the whole country, with a little bit of emphasis on those areas that are already the hotspot now, mainly Lagos and 5 other states of our country which are not so heavily impacted as Lagos, so that we have a bit of emphasis given to those areas. Over.
Excellent news right there, Honorable Hanire. So now we go to a question from Reuters to you, Dr. Moeti. And it says, how satisfied are you with the announcement that the Pfizer and BioNTech SE have made, and the fact that they've struck a deal with for South Africa's Biovac Institute to process and distribute over 100 million doses of their COVID-19 vaccines for the African Union beginning in 2022? And how satisfied are you that the fill and finish is enough technology transfer to reduce Africa's dependence on Europe and the US to make vaccines?
Okay, thank you for that important question. I think it's a very important start, and it is an urgently needed partnership to change the situation that I described and the 2 ministers very eloquently described as well. It is very important that African countries start to acquire vaccines from whatever source, and if it is through beginning with a fill and finish, and that can rapidly be scaled up and make the vaccines available, that is a very good start. As WHO, we are recommending and advocating very strongly, though, for technology transfer, because we are looking beyond this crisis, beyond the immediate future, to Africa acquiring the kind of capacities that's needed, including the expertise to produce the vaccines that are going to be needed in the future. And that will need agreements with the pharmaceutical companies who own the IP, technology transfer, even agreements around the intellectual property, so that we really get into the kind of partnerships that can be sustained into the future, that can build the capacity, indigenous capacity in Africa, indigenous knowledge, ability to use and shared technologies, of course, taking all the precautions necessary in relation to the interests of the IP owners. But it is a very good and important start.
All right, so we have a question now for you, Honorable Zahaf, from Mauritania. It comes from Halilu Dagana from the national newspaper Horizons in Mauritania, and it says, how many Mauritanians are expecting a second dose, and are these doses available? Over to you, Honorable Zahaf.
Merci beaucoup. Merci beaucoup. Merci beaucoup au journal L'Horizon pour cette question. En effet, les Mauritaniens en attente de la deuxième dose d'AstraZeneca sont au nombre de 125 000. Nous avions reçu récemment un lot de 175 000 doses. Nous avions commencé la vaccination en routine. Nous avions reçu ce lot vers le mois d'avril. Et nous avions commencé la vaccination de routine, mais récemment, en juin, on s'est rendu compte que la vaccination, l'AFLI, si la vaccination n'était pas suffisant pour consommer ce lot de vaccins avant sa permission en fin août. Et donc, on a organisé des activités accélérées, une campagne carrément de vaccination qui nous a permis de vacciner 125 000 personnes. Et donc, c'était en juin. Et la seconde dose devrait être administrée depuis maintenant 2 semaines. Et bien entendu, on a encore le temps jusqu'à mi-octobre pour administrer la seconde dose. Et donc, voilà, on a 125 000 personnes en attente de la seconde dose. Nous avons récemment eu des promesses de quelques 150 000 doses d'AstraZeneca, plutôt 165 000 promises en fin juillet. Donc, ce sera vraiment un grand soulagement pour nous parce que vous imaginez la pression sociale pour avoir cette seconde dose, surtout que nous sommes en début d'une 3e vague de Covid. Et donc, la pression est très forte pour cette seconde dose. Merci beaucoup pour votre question.
Indeed, we do hope that you do get those doses, just like we're hoping for the other countries too. So now our next question is from Ruth McLean from the New York Times, and the questions come to you, Honorable Hanire, and to you, Dr. Moeti. And it's more or less the same question. So for Honorable Hanire, what proportion of the COVID-19 tests reported in Nigeria's official figures are done on travelers, and what proportion are on non-travelers? And for the same, after the Honorable Minister has answered this, Dr. Moeti, is what proportion of tests on the continent as a whole are on travelers, and what proportion are on non-travelers? Over to you, Honorable Minister.
Exact figures for the proportion is not in this disaggregation. I can't give you off the cuff, but we have about 170,000, about 2.5 million tests done, and 170,000 positive cases so far. About 2,160 fatalities. And the tests are being ramped up. We have developed a new strategy to do tests randomly working with NGOs at hospitals, airports, and also at motor parks, particularly on travelers internally, despite the advisory to reduce travel internally. It still goes on, and congregations still go on. So we want to ramp up testing in order to increase the volume and be able to see exactly how the trend runs with this third wave of COVID-19 that is already threatening our continent.
Thank you. To you now, Dr. Moeti.
Okay, thank you. That's a very good and important question. We don't have the exact figures in WHO either, but we estimate that between 25 to 35% of the tests that are done and reported are on people that are traveling internationally. And I'd also like to say that these are mainly PCR tests. We are encouraging and would like to see countries use even more the antigen rapid tests, because that will enable then some of the testing that needs to be done to follow up on possible cases, to test for clusters of transmission to be carried out to supplement the tests that have been done on travelers. We need to keep a balance between, of course, testing people for the purpose of their being able to travel, and also to keep a focus on the public health interventions, identifying contacts, and making sure that the public health actions of isolating, preventing further transmission are carried out, and to see also when we have intense transmission happening in countries. So we're updating, in fact, our guidance and our advocacy for the use of rapid antigen tests combined with the PCR, and are also urging countries, encouraging, and will be supporting countries to find ways with their partners to report on the testing that is done with using the rapid test. We believe that this is underreported. So there's more testing being done for these public health interventions possibly than we are getting because it sometimes is using rapid tests. That's something that we're working on right now at the moment, and we think it's very important to keep that balance.
Thank you, Dr. Moeti. And the next question comes from Danielle Paquette of the Washington Post, and I'll give this to you, Dr. Mihigo. And she says, some countries are receiving doses that expire in a short period later. Are shipping delays widely putting vaccine supplies at risk of expiring before they are used?
Yeah, thank you very much, Fiona, and thanks for the question. Yeah, it's true that the short expiry dates of the supplies that are coming to the continent are indeed increasing the pressure on the rollout of the vaccine at country level. But we have seen that since the beginning of this pandemic, the most of the vaccine arrive with really a very short expiry date. Most of the time, 3 to maximum 4 to 4.5 months, which really create an additional bottleneck in terms of rollout of the vaccine. When definitely you add on the internal hurdles at country level for the deploying of these vaccines, definitely we see that it creates additional burden. So we are really working with countries. We are really working to anticipate some of these issues, because here probably the key word is anticipation, because we know since the beginning of the response that most of the vaccine are coming with that short expiry dates. So countries are now kind of used to and very well prepared to make sure that these anticipated needs are really addressed at the beginning, so that we maximize the use of the supply when they arrive in the country.
Thank you, Dr. Mihigo. Our next question comes from Camila Malplat from AFP, and it goes to you, Honorable Ehanire of Nigeria, and says, what is the current oxygen production in Nigeria, and is it enough for the whole country? She also has a follow-on question. How do you explain that there are few cases in Nigeria? Is it because people don't get tested?
Thank you. First of all, the question of oxygen. Every state of Nigeria has an oxygen production plant, and they're all being repaired at the moment, 30 of them. And the government has sanctioned the building of additional 38 oxygen production plants, which is starting now. We do not think they'll be ready in the next couple of months. There are 38 additional. We're also getting 12 liquid oxygen tanks. We already have 2 on ground, and we're getting additional 12 liquid oxygen tanks, which are produced in 2 sites, 2 cities in Nigeria, to be able to supply oxygen, liquid oxygen, along with vaporizers. We are receiving about over 1,000 oxygen cylinders. And we have been working with industrial oxygen producers to repurpose industrial oxygen into medical grade oxygen. We have also been working with Nigeria Air Force, which has a large oxygen production plant, to supply oxygen at all points of need in the country. We do believe that by the time we are through with this, we have a very sound oxygen availability, sufficiency all over the country, which will have over 70 oxygen production plants functioning. But as for now, we do not have any distress in oxygen. We are okay. So as for the number of cases, well, I do not know if you think that there are too few, but we have been doing a diligent testing, mostly driven by the states in the country. They are not the volume that we would like, but we are working on being able to step up the testing rate when we are faced with this threat of the third wave of COVID-19 by bringing in NGOs, and not only with working with state governments and local governments, but bringing NGOs who work on a strategy to collect samples and bring them to mass testing sites. So we have a larger sample. Of the samples we have so far, we are confident that they are not far from what the general picture is. We have not seen any large cases of unexplained deaths, as we call them here, because if COVID were playing a terrible role, which we are not seeing, we will see that the records in unexplained deaths or excess deaths, as it's said by epidemiologists. So we are going to improve on the testing, but so far we have no indication that we are missing a lot. Over.
Great, thank you very much. Good to know that Nigeria has all this capacity. So now we have a question that is coming from Elizabeth with The Nation, and it goes to you, Dr. Gumede, our regional virologist, and says the continent is currently experiencing a third wave. We have heard that almost 21 countries have detected the Delta variant. How many countries are actually testing people for the Delta variant, not just COVID-19 in general? Is it even a possibility to specifically test for a variant? And if not, how fast is sequencing now compared to last year? Over to you, Dr. Gumede.
Thank you so much, Dr. Fiona. And then this is a very good question because it's going to give us a position as WHO to clarify or to make very good explanation in different testing that is done for COVID. So for diagnostics, all this variant of concern has never shown that they have an impact as far as the diagnostic assays are concerned. So the only way that you can come up and tell this is a variant of concern is after the sequencing. So as far as the diagnostic tests are concerned, definitely there is no interference, or you cannot tell during the diagnostic testing that this is a variant of concern or this is a variant of interest up until that particular virus has undergone a sequencing method. However, as WHO, we are now currently, or very closely, we're gonna be rolling out a PCR screening method that is going to be at a go, be able to tell us how many of these variants are circulating in the continent. And this is going to be based on the fact that this method is going to be showing us the mutations that has been seen in the variant of concern when the sequencing method was conducted to these particular samples. So that particular mutation is going to be really telling you what kind of a variant that is circulating in that particular country and at what extent for that matter. So as far as diagnostic test is concerned, almost all the countries are testing for COVID, and then a certain number of tested positive samples are moved to the sequencing part. But we are trying now to bridge that gap of taking longer for the countries to embark themselves into the sequencing that is taking far long, because sometimes when the country is not having a sequencing capacity, they have to ship their viruses to the neighboring country that is having a sequence facility. So with that, we're going to be introducing this PCR screening, and then a portion of those that have already been screened as the variant of concern through this PCR screening method that is coming in will be also be sent to the sequencing labs to confirm what has been identified by the PCR screening. So yes, if we compare the number of countries that has been engaged into the sequencing as far as the continent is concerned, is really has increased so much compared to the beginning of the pandemic. So we are even more than close to 30,000 of the sequencing data that has been produced by our African countries. In the entire continent, I think we are only left close to 4 or 5 countries or even 3 or 4 countries that has not reported the sequencing data. So there has been a drastic increase in terms of the countries that has reported the sequencing data in the continent. Over to you.
Thank you very much, Nixie. So we have our next question going to the Honorable Minister Zahaf in Mauritania. And it's from Sandrine Bathard-Claire from Le Monde, France, and says, where are we regarding medical oxygen production and supply issues in Mauritania, knowing that it is essential in COVID-19 treatment?
Merci beaucoup. Merci beaucoup pour cette question. J'en profite pour informer d'abord que la Mauritanie vient d'acquérir son séquenceur. Nous sommes en train de l'installer et espérons que d'ici mi-août, il sera opérationnel. Et donc, au besoin, avec bien entendu un peu d'appui technique de l'OMS, nous pouvons aussi recevoir certainement des échantillons d'autres pays au besoin pour le séquençage. Maintenant, par rapport à la question de production de l'oxygène, effectivement, c'est une question très difficile ici en Mauritanie. Nous avons 7 centrales d'oxygène d'une capacité chacune de 430 litres minute. Mais elles connaissent toutes des difficultés de maintenance, de fonctionnement. Aussi, il n'y a pas d'expertise en la matière pour pouvoir assurer la maintenance et la performance de ces centrales d'oxygène. Et aussi, c'est des centrales qui sont utilisées dans les hôpitaux pour l'ensemble des malades. Pour les malades Covid, pour les malades de la réanimation, les malades de pneumo, des services de pneumologie. Donc, parfois, si le nombre de malades augmente, ces centrales d'oxygène connaissent des perturbations et surtout la pression de l'oxygène auprès des malades chute et ça pose des problèmes de prise en charge des malades. Alors, le gouvernement a décidé récemment de renforcer la capacité de production d'oxygène et pour ce faire, nous avons demandé l'appui de l'OMS et nous attendons un expert de l'OMS qui viendrait nous appuyer à développer un cahier de charges, analyser les besoins en oxygène et voir les capacités au niveau des différentes structures hospitalières et en particulier les structures où des malades Covid sont hospitalisés. Et donc, suite à cela, on aura un cahier de charges clair aussi bien pour le renforcement de la capacité de production que pour la maintenance et le bon fonctionnement de ces centrales d'oxygène. Sinon, pour le moment, ça pose des problèmes. Merci pour votre question.
Yeah, thank you for that response. And indeed, we do hope that you can set up the plant really soon and have oxygen running in the country. So we have our final question from Andrew Meldrum from the Associated Press. And says South Africa has fully vaccinated more than 1 million and has a goal of vaccinating 67% of the population by Feb 2022. What other African countries have comparable vaccination campaigns? This is over to you, Dr. Mihigo.
Well, thank you, Fiona. I think there are several countries on the continent that have done quite a very good job in vaccinating their population. We have heard the Honorable Minister from Nigeria, who has given us the numbers. Millions of people have already received doses in Nigeria. And I believe Nigeria is a country, if they had enough doses, they could have vaccinated even more people than what they've achieved so far. We have several other countries on the continent that have done quite a very good job in reaching out to their population. If we looked at West Africa, Ghana did a fantastic job, Cote d'Ivoire, Senegal. We have heard from Mauritania, the effort that they've done to accelerate vaccine. In central part of the region, we have also Angola that have done really fantastic work. In the eastern parts, Uganda, Kenya, Rwanda, Botswana in the southern, Namibia. So we do have a very great momentum on the continent. I think one of the issues that many countries were facing was the issue of supply. And we've heard from Dr. Moeti that things have been put in place to prepare better for additional doses that are coming. So we do believe that if the supply situation improve, with all the preparation and the experience that the country have drawn from this first phase, I think we will see definitely an acceleration of vaccine rollout in many other countries on the continent. Over.
Thank you very much, Dr. Mihigo. So we now have our final question. We do have so many questions that are in, but we've run out of time. And we do have our final question to you, Dr. Tierno Balde, and says Niger has not experienced many cases. What can the rest of the region learn about the virus from this situation, both the natural context and the government response there?
Yeah, thank you, Dr. Fiona. Indeed, Niger, has been reporting almost 55,000 of cases of COVID-19, and we have seen a kind of increasing about 0.48% of cases during the past week, but this is not that much a major increase at all. And we know that there have been some effort which has been conducted for increasing the testing capacity, but also the vaccination in different public areas, especially for the testing and also for the vaccination. But one point which is important is also the fact that Niger is in some provinces of Niger, there are some humanitarian situations, and notably in the region, on the region of Difa, and the rolling out of different response intervention in those contexts is quite very challenging. But there have been some effort on the vaccination, for vaccinating both the local communities, but at the same time also the displaced population. So I do think that there are several different factors explaining the situation in Niger, but things are moving ahead, both in terms of vaccination, both in terms of also treatment capacities, but at the meantime also on the vaccination. But all of those countries, including Niger, we are really monitoring them on a very regular basis here from the regional office. And whenever there is really a sharp increase in the number of cases, then actions are taken for supporting these member state countries, for addressing the situation. Thank you, and over.
Thank you, Dr. Balde. So we are coming to the end of this virtual press conference, and now let's turn to our three panelists and hear any final messages. You do have a minute each to give us your parting shots, and I'll start with you, Honorable Osagie Ehanire from Nigeria, and this also comes with a question for you. Sounds like somebody is quite worried from Nigeria, and they say, and this is from Africa Report, and says, will the government consider another total lockdown if Nigeria enters into full third wave and there's a spike of confirmed coronavirus cases?
Well, to answer the question before I make my comment, Nigeria will not do a lockdown except there's a very strong indication. We have already worked out plans for targeted surgical lockdowns with conditions for support to all those who will be affected. And there are various degrees that are already planned, and we are waiting to also continue refining that plan according to the way the situation develops. But lockdowns are an absolute last card that you play. You do not put them in front. And whenever we are going to have to do that, it's going to be very targeted. It's not going to be generalized. And it will be with a lot of conditions to ease any inconveniences that are in there. And my advice is for regional collaboration. We already have the very strong WHO continental support, which we are enjoying. But we are also working with the West African Health Organization, the WAHO, to continue to support each other in the West African sub-region. We hold conferences every now and then. We are due to hold another one very soon. Share experiences and also manage our borders, because cross-border activities are going on everywhere, and we must be able to manage these activities so that we do not make things worse for each other. So I will advise that that goes on in other places. I again commend the leadership of Dr. Moeti and the Africa region, WHO, for the work they are doing in trying to look at our own peculiar problems and give us the suggestions for being able to respond as we have been doing so far. This third wave will be an absolute challenge for us, and if we can manage it well, I believe we will have learned a lot. Over.
Thank you very much, Honorable Dr. Ehanire. Now to you, Honorable Dr. Sidi Zahaf from Mauritania, for your parting words.
Merci beaucoup. En conclusion, c'est juste pour remercier l'effort qui est en train d'être déployé pour renforcer l'accès au vaccin. L'effort de notre région sous le leadership de notre directrice régionale de l'OMS. Et nous portons beaucoup d'espoir sur ces efforts, que ce soit sur le plan d'acquisition et de distribution des vaccins ou encore sur même les négociations pour renforcer la production des vaccins sur le continent. Je pense que c'est la solution durable et vraiment fondamentale sur laquelle on doit tous travailler. Entre-temps, je reviens sur les critères de distribution des vaccins et l'information, le partage d'informations sur les éventuelles possibilités d'acquisition de vaccins pour que nous puissions mieux organiser nos activités de vaccination et les planifier, mobiliser les ressources, que ce soit humaines, les ressources pour les coûts opérationnels, etc. Donc, tout ceci demande vraiment qu'on ait un peu de visibilité sur la disponibilité des vaccins. Je vous remercie beaucoup pour ce point de presse très utile. Et merci. Merci. À vous.
Thank you very much, Honorable, and it was nice having you too. Now over to you, Dr. Moeti, for your closing remarks.
Yes, thank you very much. First, I'd like to sincerely thank my two co-panelists, the Honorable Ministers of Nigeria and Mauritania, for having come to share with us what you are doing, what you are achieving, and what you are facing as challenges. I think it enriches our knowledge, and I'm hopeful that our colleagues, the journalists, will spread this information around to really show the efforts and the work that African governments with partners are doing. I'd like to also say that together right now, we face a Herculean task. We face a huge task and also a very big opportunity. And I'm very encouraged by the determination shown by our countries to deliver of their best. And just would like to assure everybody that WHO is there. We are mobilizing, we are advocating on the issue of knowledge, information being shared transparently, just to assure the Minister of Mauritania that as WHO, as part of COVAX, we are working very closely with our colleagues where the pulling together of information about the availability of vaccines and the decisions are being made to keep to the principle of COVAX, that each of the countries will move equitably together in terms of how the vaccines are distributed. Of course, those countries that have also invested in vaccine development, which are mainly wealthy countries, are also at a bit of an advantage. Sometimes it's difficult to predict because the situation has been so unpredictable. Agreements are made and then they are broken. And there is a certain concern about promising what can be delivered, but just to assure that we will continue every effort to make sure that we participate in the discussions and get the information out to countries to really enable them to plan. And then just to finish, we have to continue as partners working in Africa, as African governments and as African people, to do our best to take every advantage of every single vaccine. So I'd like to urge our families, our people to be ready to come forward and take advantage of the vaccines when they are available for you, when you are being called by your government. And before that, please continue to do your best to sustain the prevention measures, your masks, your distance, and the hygiene measures. These are very, very important until we arrive at a time when we, like the rich countries, can start going to football matches and can start going on the beaches. That moment has not yet come. And I'm very hopeful that with the hard work that the governments are doing, we will start to restore normal life on our continent again. Thank you for having joined us for this press conference.
Thank you very much, Dr. Moeti, for that very loud and clear final call. So for our Francophone reporters, our experts, Dr. Tieno Balde, the Deputy Incident Manager for the COVID-19 response for Africa, and Dr. Richard Mihigo, the Coordinator for Vaccine Preventable Diseases Program, will stay online for a few more minutes to answer your questions in French. Otherwise, we thank you very much for joining us and do have yourselves a great day.
Bonjour à tous et bienvenue dans cette session entièrement en français de la conférence de presse de l'OMS Afrique. Comme il vient d'être dit, deux de nos experts sont là pour répondre à vos questions. Le docteur Richard Mihigo, qui est coordinateur du programme de vaccination et de mise au point des vaccins, ainsi que le docteur Tierno Baldé, qui est responsable adjoint de l'intervention d'urgence aussi au bureau régional de l'OMS Afrique. Cette première question sera pour vous, docteur Baldé. C'est une question de Sandrine Berthaud-Claire du journal Le Monde en France. C'est une question sur la production d'oxygène médical. Voici la question. Qu'en est-il des problèmes de production et d'acheminement d'oxygène médical sur le continent, qui est un problème crucial pour bien prendre en charge les formes les plus graves de la maladie?
Très bien, merci pour cette question vraiment très pertinente en ce moment-ci, lorsqu'on observe un peu vraiment la dimension de cette vague-là actuellement. Donc, je pense que ça a été dit plusieurs fois ici, on a fait une espèce d'assessment, une espèce d'évaluation initiale des capacités des différents pays. Et on se rend compte que très peu d'entre eux avaient même un niveau pratiquement de 30% des capacités voulues ou bien en tout cas désirées pour pouvoir produire suffisamment d'oxygène pour traiter les patients, donc des cas qui présentent des formes sévères ou bien des formes critiques donc, de cette maladie-là. Donc, les capacités sont extrêmement basses et ça fait partie un peu d'une situation que nous héritons ici, là, des capacités des différents systèmes de santé. Donc, cette capacité, elle est faible. Par contre, depuis les quelques mois là où on a vu cette augmentation importante donc, de ces cas-là, notamment et puis donc dans nos pays aussi. Donc de nombreux efforts ont été faits et avec la commande donc au niveau du marché global de plusieurs cylindres donc qui permettent donc de stocker cet oxygène là, mais également aussi les efforts qui sont faits pour la réparation donc de ces centrales de production d'oxygène. On l'a mentionné tout à l'heure du côté du Nigeria, les actions qui ont été faites du côté de la Mauritanie, du côté de l'Ouganda ça a été fait, du côté de la RDC ça a été fait donc pour augmenter la capacité de production en oxygène. Mais en plus de ça aussi donc on a vraiment acheté assez rapidement, donc soit du côté local ou bien du côté sous-régional et acheminé un peu ces outils-là donc de production d'oxygène dans différents pays, là, notamment à partir du Kenya, par exemple, pour l'Ouganda. Donc, cette dynamique-là un peu sous-régionale. Donc, c'est ça véritablement la situation. Donc, c'est une situation qui est là, qui est préoccupante, mais nous espérons ici, avec les efforts qui sont déjà faits, que nous pouvons arriver à un certain niveau optimal. Et un dernier point qui est important à mentionner, c'est qu'on mobilise aussi des équipes internationales donc qui viennent avec des matériels et des équipements, ce qu'on appelle généralement dans notre jargon ici les équipes médicales internationales, donc qui viennent toutes prêtes pour pouvoir supporter donc la prise en charge de ces cas sévères-là et de ces cas donc critiques. Donc c'est des pays, c'est des équipes qui ont été déjà déployées avec notre support de l'OMS en RDC, en Ouganda, on voit pour le cas de du Botswana, de la Namibie. Donc tous ces différents éléments devraient nous permettre au moins d'arriver à un niveau optimal pour pouvoir répondre donc à ce besoin important. Merci à vous.
Merci, docteur Baldé. Et la question suivante, qui sera aussi la dernière question, puisque nous en avons deux, sera pour docteur Richard Mihigo. C'est une question de Kalilou Diagana du quotidien mauritanien Horizon. Voici sa question. Selon l'OMS, le partage de doses est essentiel pour mettre fin à la pénurie d'approvisionnement en vaccins. Ce partage étant la discrétion des pays riches, avez-vous un plan B pour l'Afrique? Docteur Richard Mihigo.
Merci beaucoup pour la question. Peut-être on en a parlé même temps. Je dirais dans ce suite depuis le début de cette pandémie, l'Organisation mondiale de la santé a fait un très fort pour une certaine équité dans la discussion et non seulement à travers les moyens mais de manière palpable. Nous devons vaincre cette pratique si tout le monde a agi dans la même direction. Effectivement, l'initiative Covet qui est lancée par la générique de l'OMS avec comme ambition, effectivement, de mobiliser.
Pardon, Dr Mihigo, votre microphone est un peu, je ne sais pas si vous pouvez, il y a un problème d'audio. Je ne sais pas si vous pouvez essayer de. On n'a pas pu vraiment entendre ce que vous avez dit.
Je ne sais pas si c'est là. Est-ce que là, ça va mieux?
Non. Donc, je ne sais pas. Je pense que si ça ne marche pas, il faut que.
C'est pas Tierno, est-ce que bon.
Ok. Je ne sais pas si. Oui, bon. Tierno, je ne sais pas si tu peux.
Pourriez-vous, s'il vous plaît, répéter la question, que je la saisisse très bien, s'il vous plaît?
Non, il disait ce mouvement bien.
Non.
La question.
Désolé.
Pardon, la question concerne le partage de doses que l'OMS estime essentiel pour mettre fin à la pénurie d'approvisionnement en vaccins. C'est une question de Khalilou Diagana, du quotidien mauritanien Horizon. Mais ce partage étant à la discrétion des pays les plus riches, avez-vous un plan B pour l'Afrique?
Oui, je pense que le docteur Migo en a parlé pendant toutes ces dernières semaines-là, tous les efforts qui sont faits dans le mécanisme donc, du COVAX pour pouvoir vraiment avoir ce partage équitable des vaccins qui sont disponibles avec l'arrivée donc de ces environ 50 millions donc, de vaccins à partir du gouvernement, d'une donation donc, du gouvernement américain. Donc, ce partage-là est en train d'être fait donc, de façon transparente, de façon objective en fonction des capacités des pays donc, à les utiliser donc, assez rapidement aussi. Donc, il y a vraiment tout un système qui est mis en place donc, pour s'assurer donc, de cette gestion efficace donc, de ces différents vaccins-là. Donc, je pense que cette plateforme-là qui est une plateforme vraiment multisectorielle et puis multi-pays avec donc, notre support technique. Donc, c'est un des mécanismes vraiment qui fonctionne actuellement, donc qui va certainement aller aussi, on va pouvoir aller de l'avant, donc pour qu'il y ait cette distribution équitable. Mais en plus de ça, on sait qu'il y a les autres mécanismes aussi qui sont mis en place par l'Union africaine notamment, donc l'initiative AVAT aussi, donc qui sont des mécanismes qui permettent aussi d'avoir accès, de pouvoir acheter donc ces vaccins-là auprès donc des grandes compagnies donc pharmaceutiques. Donc tous ces éléments-là avec les mécanismes bilatéraux directement avec les pays, tous ces mécanismes nous aideront, nous espérons donc à pouvoir arriver vers ces cibles que nous avons fixées. On venait juste tout à l'heure de parler donc de la problématique par exemple avec le Niger qui a pu avoir des vaccins qui sont venus donc de la Côte d'Ivoire par exemple pour pouvoir les appuyer. On a vu des exemples aussi auparavant au niveau avec la RDC supportant donc Madagascar. Donc c'est vraiment tout cet ensemble-là de mécanismes multiformes quelque part, donc de façon assez disons dynamique que nous essayons donc d'encourager en fonction de ce contexte-là pour pouvoir adresser ces besoins-là qui sont quand même importants, cruciaux et assez urgents. Merci à vous.
Merci, Dr Baldé. Merci, Dr Mihigo. Toutes nos excuses pour les petits problèmes techniques. Voilà, nous avons fait le tour des questions en français qui nous restaient. Je vous souhaite à tous une bonne semaine et je vous donne rendez-vous la semaine prochaine.
Merci.
Au revoir.